Did you know that topical nail treatments don't really work? Many patients, they spend months and even years trying to do topical nail fungus. I had a patient that came in this week, and when she came in, she was putting this topical nail polish. One of the more common ones that's prescribed to doctors is called cyclopirox or Penlac. And it had this cake of about 2 or 3 millimeters on top of it of this white goo that I had to remove off, because one of the things with these topicals is you have to remove it, you have to file it down every so often to get rid of it. And if you tried these topicals or any of the other topicals, there's a really low success rate with these. Why is that? Well, if you look, there are hundreds, if not thousands, that you can buy on Amazon to get rid of nail fungus, or they quote that you can get rid of nail fungus, and most of them have a money-back guarantee. And the reason I say that they don't work is because if there was only one that worked, there would only be one treatment. It doesn't exist. Now, what we find works best in our office, the most successful, is an oral medication. Now, you might be saying, oh no, I can't take oral, it's going to kill my liver. That's not something that we see. You need to talk to a doctor that gives out a lot of the oral medication to see if it really works for you, if it's going to be a good option for your foot. What I find is if you're young, if you're healthy, if you have a fine liver, you're going to be able to take the oral medication. The way I tend to do it is I do it after I do a LFT or liver function test. And that is successful, I would say probably 60 to 80% of the time. Nothing's 100%. I always recommend taking a nail sample as well if you're concerned, because sometimes nail thickening is not always a fungus. Sometimes the nail thickening can be caused by micro trauma because of your shoe hitting on the top of your toenail. So I don't find that topical works all that effective. Now, people will tell you about Vicks, they're going to talk about tea tree oil, they're going to talk about hundreds of other things. Now, if you have a very mild case of nail fungus, that might work, in which case you don't need to see a specialist. If those things don't work, give it 3 months, give it 6 months. If it doesn't work, then I would go see a specialist, and they probably take a nail sample and they may give you an oral medication. But you might be asking, what about laser? We have 3 different lasers in our office, and I still think that the oral is more effective. Now, if you absolutely don't want to do the oral, it's fine. You can start with laser. It's a lot of visits, not as successful, but then if the laser doesn't work, then you can transition to the oral. That's a fine option. If you are dealing with nail fungus, you don't have to spend hundreds of dollars or a lot of time on this. It can be treated fairly easily by one of these other medications. Now, another thought is there is only one really good one out there, and it's still generic, right? It's generic because there's nothing newer that's come along that works just as well as the terbinafine or the Lamisil that we use these days.